Motivating operations and discriminative stimuli are some of the most frequently tested concepts on the BCBA exam, and they often appear in tricky scenarios that look similar on the surface. Many test takers miss these questions not because the content is difficult, but because the exam expects you to separate changes in motivation from signals about reinforcement availability. In this walkthrough, we'll break down the core differences in a simple and clear way so you can quickly recognize which process is happening in any scenario. As you follow along, keep an eye on how value changes and reinforcement signals show up differently, and you'll see why this topic can significantly boost your exam confidence. Motivating operations change the value of a reinforcer or punisher, and they shift how often behaviors occur that have produced that outcome before. They can either increase value or decrease it. When thirst increases the value of water, behaviors like drinking or asking for water become more likely because water is momentarily more important. Discriminative stimuli work differently. Instead of changing value, they signal that reinforcement is available for a specific behavior. They evoke that behavior because it has been reinforced in that particular context in the past. A working vending machine is a good example because it tells you that inserting money will lead to a soda. So while MOs change motivation and can affect many different behaviors at once, SDs act as signals that a specific behavior will be reinforced based on its history in that setting. Question 1. A child begins asking for snacks much more frequently before lunchtime because they have not eaten since breakfast. What explains this increase in requesting behavior? A. SDB, EOC, satiation D, stimulus generalization. This question is asking you to look for deprivation cues that point to an increase in reinforcer value, which is often a sign of an establishing operation. To approach this question, look directly for signs of deprivation because hunger increases the value of food and makes requesting more likely. The page highlights phrases such as wants more, value increased, or after not having X, which immediately point to an establishing operation. You begin by identifying the behavior, asking for snacks more often. Then look for the deprivation indicator, which is not eating since breakfast. Hunger increases the value of food, and establishing operations increase all behaviors that have produced that reinforcer before. The key takeaway is that phrases linked to deprivation typically signal an EO. The correct answer is B, EO. Hunger raises the value of food and increases behaviors that have historically produced food, such as requesting. Option A is incorrect because SD signals availability, not value. Option C is incorrect because satiation is the opposite process and would decrease value and reduce behavior. Option D does not fit because the child is not generalizing responding across stimuli. The core concept is that deprivation increases value and increases requesting. Question 2. A teenager asks their mom for permission to go out because she almost always says yes, but rarely asks their dad, who usually says no. What is the mother? A. MOB, SDC, AOD, condition reinforcer. This question highlights whether the difference is driven by motivation or reinforcement availability. To approach this question, compare indicators of value change and reinforcement availability. For MOs, you look for deprivation, value increases, or behavior frequency shifts. For SDs, you focus on reinforcement history and signals of availability in specific contexts. The example shows that the teenager's motivation to go out stays the same, but the mother consistently reinforces the request. That means the mother signals reinforcement. Since nothing suggests value change, and the key difference is reinforcement likelihood, this fits the definition of an SD. The correct answer is B, SD. The mother has a consistent reinforcement history, which signals that asking her will likely be reinforced. Option A is incorrect because motivation does not change. Option C does not fit because an AO reduces value. Option D is wrong because the mother is not functioning as a reinforcer. This scenario reflects the definition of an SD, a stimulus that signals reinforcement availability. Question 3. A child loves playing with a toy car. After playing for an hour, the child stops choosing it and switches to other toys. A. AOB, SDC, SD, stimulus control. This question tests whether you can identify the effect of overexposure on reinforcer value. To approach this question, Recognize cues of satiation, since too much access to a reinforcer reduces its value. This pattern describes an abolishing operation. The reinforcer's value decreases, so the behavior that produced it also decreases. Key exam clues include phrases like "after playing for an hour," "stops choosing it," "switches to other toys," and "too much access." These point directly toward reduced value and reduced responding, which is the hallmark of an AO. The correct answer is AO. Overconsumption decreases the value of the toy car and reduces the behavior of choosing it. Option B is incorrect because SD changes availability, not value. Option C is wrong because S signals no reinforcement, which is not described here. Option D does not apply because stimulus control is not the issue. AO is clearly indicated by reduced value and reduced behavior. Question 4. A learner only requests help when their therapist is present because the therapist consistently honors help requests. The therapist is functioning as a NA, EOB, AOC, SDDS. The question focuses on whether motivation changed or whether reinforcement predictability changed. To approach this question, look at context-specific reinforcement. You ask which stimulus reliably signals reinforcement for the behavior. The strategies include identifying whether the stimulus predicts reinforcement, evaluating differences in availability, and separating motivation from reinforcement likelihood. Diagnostic cues include phrases such as "only when this person is present" and "consistent reinforcement history." These point toward an SD because the therapist's presence signals reinforcement availability, not a change in motivation. The correct answer is C, SD. The therapist's presence signals that help requests will be reinforced. Option A is incorrect because no value change is shown. Option B is also incorrect because nothing indicates reduced value. Option D is wrong because S signals no reinforcement, and reinforcement is present here. The therapist functions as a discriminative stimulus indicating reinforcement availability. Question 5. During PE class, a student requests water frequently because they are thirsty and because the coach always allows water breaks. What combination is operating? A. SD only B, EO only C, EO plus SDD, AO plus S. The question examines whether both value and availability are at play. To approach this question, break the scenario into two components. Thirst is an EO because it increases the value of water and evokes requesting. The coach reinforces water requests consistently, which makes the coach an SD. The page explains that when both value and reinforcement availability increase together, the scenario reflects EO combined with SD. The key insight is identifying a value shift and a reinforcement signal in the same situation. The correct answer is C, EO plus SD. Thirst increases the value of water, which is the EO, and the coach's consistent history of granting water breaks signals that the request will be reinforced, which makes the coach an SD. Both motivation and reinforcement availability are operating at the same time. SD alone cannot explain thirst, EO alone cannot explain the role of the coach, and AO plus S delta is the opposite pattern. The key idea is that motivation influences value and discriminative stimuli signal where reinforcement will occur. A child stops requesting chips after eating multiple bags during a party. Which behavioral process best explains the decrease in requests? A. AO, B. S delta, C. SD, D. Positive punishment. This question asks you to focus on how overconsumption changes the value of the reinforcer and influences behavior. To approach this question, look for clear signs of overconsumption because having too much of a reinforcer decreases its value. When the value decreases, the behavior that produced it typically decreases as well. The slide highlights indicators such as too much, had enough, and tired of, which are strong cues for an abolishing operation. You check whether the reinforcer's value went down and whether the related behavior also decreased. Overexposure leading to reduced motivation is the classic pattern of an AO. When a scenario emphasizes satiation or loss of interest after consuming a lot, it is almost always pointing to an abolishing operation. The correct answer is A. AO. After too much access to chips, the value of chips decreases and the requesting behavior decreases as well. S delta is incorrect because that signals no reinforcement availability, not value reduction. SD is incorrect because it signals reinforcement availability, not changes in motivation. Positive punishment does not apply because nothing aversive occurred. AO fits because satiation reduces value and reduces behavior. This is the defining feature of an abolishing operation. A student learns that asking the substitute teacher for extra break time never results in reinforcement. The substitute teacher becomes what? A. SD, B. S delta, C. EO, D. AO. The focus here is on identifying a stimulus that reliably predicts the absence of reinforcement. To approach this question, identify whether the scenario is describing a lack of reinforcement. The slide points to phrases such as never results in reinforcement, no longer reinforced, and consistently not reinforced, which all indicate the presence of an S delta. S delta is specifically about reinforcement being unavailable, not about value changes. You also look at whether the learner stops engaging in the behavior in that particular context, which matches the defining function of S delta. When no value shift is described, and the only issue is reinforcement unavailability, the correct identification is S delta. The correct answer is B, S delta. The substitute teacher signals that asking will not be reinforced. SD is incorrect because SD signals reinforcement availability. EO is incorrect because motivation is not changing here. AO is incorrect because nothing indicates reduced reinforcer value. S delta is the stimulus that indicates that reinforcement is not available in that situation. That is exactly what this scenario describes. A learner highly values iPad time, but only asks for it when the instructor who consistently provides access is in the room. A. iPad, B. Instructor, C. Deprivation, D. Classroom. This question focuses on identifying which stimulus predicts reinforcement availability for asking. To approach this question, distinguish between deprivation, which relates to EO, and reinforcement history, which relates to SD. The slide highlights cues such as only when, consistently, and reinforcement history, which point toward an SD. You start by identifying the reinforcer, check whether deprivation is mentioned, and then determine which stimulus consistently predicts reinforcement. In this case, the learner already values the iPad, and the instructor is the one who reliably provides access. That makes the instructor the discriminative stimulus. The correct answer is B, instructor. The instructor's presence signals that asking for the iPad will be reinforced, which is exactly what an SD does. The iPad is the reinforcer, not the discriminative stimulus. Deprivation would indicate EO, which is not highlighted in this scenario. The classroom does not reliably predict reinforcement. The instructor is the correct choice because the instructor's presence signals that reinforcement is available. A child begins screaming more frequently in the grocery store because skipping their nap increased irritability and discomfort. A. SD, B. EO, C. AO, D. S delta. The situation describes how sleep deprivation increases discomfort and increases the value of escape or attention. To approach this question, look for signs that discomfort has increased the value of escape or attention. The slide explains that increased irritability or lack of sleep often increases the effectiveness of certain reinforcers, which is characteristic of an EO. You check whether the reinforcer's value increased and whether behavior increased with it. EO increases both value and the likelihood of behaviors that have produced that reinforcer in the past. When problem behavior is paired with discomfort, irritation, or lack of sleep, EO is a strong candidate. The slide also notes that SD only signals availability, not changes in motivation. The correct answer is B, EO. Lack of sleep increases the value of comfort, escape, or attention, and increases behaviors that have produced those outcomes before. SD is incorrect because the stimulus is not about reinforcement availability. AO is incorrect because that would decrease value. S delta is incorrect because it signals no reinforcement availability, not increased motivation. This pattern clearly matches an EO because the reinforcer has become more effective due to deprivation. A learner asks for the trampoline only when they haven't used it all day and when the therapist who always grants access is present. A. SD only. B. EO only. C. AO plus SD. D. EO plus SD. This question highlights scenarios where both value and reinforcement availability are changing together. To approach this question, Examine the scenario in two parts. First, long deprivation indicates an EO because it increases the value of the trampoline. Second, the therapist who consistently grants access functions as an SD because the therapist signals that the request will be reinforced. The slide explains that when both value and availability shift, the correct answer is EO plus SD. You identify deprivation, identify the reinforcement signal, and combine the two components to reach the correct conclusion. The correct answer is D, EO plus SD. Long deprivation increases the value of the trampoline, which is the EO. The therapist consistently granting access signals reinforcement availability, which is the SD. Both factors jointly evoke the request. SD alone would miss the deprivation component. EO alone would miss the reinforcement predicting role of the therapist. AO plus S delta is the opposite of what is happening here. EO combined with SD matches the described scenario. You've now worked through the differences between motivating operations and discriminative stimuli. Understanding how changes in value interact with reinforcement signals is a key skill for answering BCBA exam questions accurately. The slides encourage continued practice through full mock exams, concept walkthroughs, analytics, and exam simulations. For structured resources and deeper preparation, additional support is available through bcbmockexam.com.